So if someone in your family has had a stroke and their hand or leg just won't move, this video was made exactly for you. The next few minutes are going to completely change the way you think about stroke recovery. Hello, I'm Dr. Mohit, your physiotherapist, and today I'm going to tell you about the 4 techniques, and not just the techniques but also when and how to use those techniques after a stroke. That's why watch the complete video and do not do these techniques blindly. Because what works perfectly for one stroke patient can have the exact opposite effect on another. Today I'm going to tell you which technique, when to use it, in which direction and at what speed. And along with that, what is the Brunstorm scale? What is the difference between flaccid and spastic muscles? All of it in simple and easy language. Watch this video till the end. Do not skip because of the most important part for your case is inside this video. And if you haven't subscribed yet, please do it right now to get more home-based rehab techniques and updates. First, let's understand what exactly is a stroke. Our brain controls every single part of our body. When the blood supply to any part of the brain gets blocked or a blood vessels bursts, the brain cells in that area starts to die. And the opposite body part that those brain cells were controlling, that body part stops working. That is why after a stroke we see the arm and leg on one side becomes weak or completely paralyzed. The face droops on one side, speech becomes difficult, walking becomes a challenge. But here is the good news. The brain has an amazing property called neuroplasticity. So it means the brain can repair itself, it can build new pathways, create new connections. And physiotherapy techniques, icing, brushing, tapping, vibration, and other techniques, all of these are used to simulate exactly the neuroplasticity. We send repeated signals to the brain so that it builds those new pathways. Okay, now let's talk about the most important concept that probably no one has explained to you before. After a stroke, muscles can go into two very different conditions. Okay, the first one is flaccid and spastic, and the treatment for both these is completely opposite. So let's understand each one. What is flaccid? Flaccid means the muscle is completely loose and lifeless. You lift the arm and it just falls back down. No tension, no resistance, nothing, like a piece of cotton, completely soft. This happens in the early days after a stroke. What is spastic? So spastic means the muscle becomes very stiff and tight. Try to straighten the arm, it resists and locks up. The arm stays pulled against the chest, fingers curled into a fixed position. So like a rubber, stretch it and it pushes back. This develops a few weeks after a stroke. Now the most important point, the technique that wakes up flaccid muscle. If you do that same technique on spastic muscle, it will make the muscle even more stiff. That is why before starting any treatment, you must identify whether the patient's muscle is flaccid or spastic. So always confirm first that whether your doctor or physiotherapist is telling you. Now let's talk about the Brunstorm scale. This of it as a map that tells you exactly where the patient is on their road to recovery. So there are 6 stages in Brunstorm scale. Stage 1 is completely flaccid, no movement is there. Stage 2 is spasticity begins to appear, light reflexes comes. Okay, so this is actually a good sign the brain is starting to work. Stage 3 is spasticity at its peak. Very stiff movement happens but only in rigid fixed position. Stage 4 spasticity starts to reduce. Some selective movement appears only if you are under good rehabilitation. Stage 5 is close to normal, coordination improves significantly. Stage 6 is near to normal, almost full recovery is there. Today we are going to cover stage 1 to 2, the flaccid phase, what to do, and stage 3 and 4 in spastic phase. So now let's start with the technique 1, icing. The first technique is icing. Wrap some ice in a cloth. That's all the setup you need actually. Now here is the most important thing. Icing is done in a completely different way for a flaccid and spastic patients. How to do icing for a flaccid patient? Speed fast, very fast, 1 to 2 strokes per second. Quick brusque strokes. Direction top to bottom, hip to knee, always proximal to distal. Target directly over the muscle belly that is not working. 3 to 5 strokes and 30 seconds of hold is enough. If you keep it in one place for more than 10 seconds, the effect reverses completely. How to do icing for a spastic patient? Here you do the exact opposite. Speed very slow. Place the ice on the muscle and hold it there. Hold for 20 to 30 seconds. No stroking, no movement. Just place it. This slows down nerve conduction. The muscle relaxes. Never do fast strokes on a spastic muscle. This is the biggest mistake people usually do at home. The second technique is brushing. Get a soft paintbrush, the kind artists use, or a soft toothbrush from home. Works too. We brush over the skin and the nerves just beneath the skin get activated. This sends signals up to the brain saying, hey, this part is still alive. You can do something. How to do brushing in the flaccid patient? Speed fast 2 to 3 strokes per second, direction in the direction of hair growth. Always top to bottom, proximal to distal. Touch very light like a feather, almost tickling. 3 to 5 seconds of brushing, then 30 seconds to repeat. One thing I want to know you that the effect can take 30 to 50 minutes to show up after all these techniques. Now, how to do brushing for a spastic patient? Here we don't do fast brushing, here we do slow stroking. Sit the patient up, place both your palms on their back on either side of the spine. Start from neck to the lower back with slow stroking. Each stroke from rhythmically. Do this for 3 to 5 minutes continuously. Watch closely, the patient's shoulders will drop on their own, their jaw will unclench, the breathing will slow down. That is the sign it's working. The third technique is tapping, and this is the easiest one to do at home. We use 2 to 3 fingers together to tap the muscle. There is tiny sensor inside the muscle receptors called muscle spindle, which gets activated and sends signals to the brain, tell them to move. How to do tapping for a flaccid patient? Bring 3 fingers together, tap directly on the belly of the muscle that isn't working. Direction: tap in the direction of the muscle pull. For example, tapping the wrist extensors. Tap toward wrist extension, speed 1 to 3 seconds, brisk 10 to 15 taps. This is the most important part. Tap followed immediately by a verbal command. That combination is the most powerful thing that you can do. How to do a tapping in spastic muscle? Here is the rule is completely different. Never tap on the spastic muscle, it will tighten even more. Tap on the opposite muscle, the antagonist muscle. Example, the arm is stuck on a bent position, bicep is spastic. So we have to do on triceps. Example, the leg is rigidly extended. So tap on the back of the thigh on the hamstrings. When the opposite muscles get tapped, the spastic muscle automatically relaxes. This is called reciprocal inhibition. It's the body's own system. Okay, so tap the immediately, try to move the joint. The window right after tapping is what you need to use. Now the fourth technique is vibration. The fourth and most powerful technique, vibration. For this you need a handheld electric vibrator available at any pharmacy or online. So vibration fires the muscle spindle so rapidly that a continuous contraction happens in the muscle without the patient even trying. This is called the tonic vibration reflex. And the best part, the effect lasts 10 to 20 minutes even after you stop. That window after vibration is when you should do all the exercises and all. So vibration for a flaccid patient, place the vibrator directly on the muscle belly that isn't working. Direction: top to bottom, proximal to distal. So 32 seconds is enough. The moment you turn it on, ask the patient, now try to move it. Immediately do exercises. That is the sequence. How to do vibration for a spastic patient? Same rule applies here. Never place the vibrator on the spastic muscle. The spasticity will increase dramatically. Place it on the opposite muscle. That is, bicep is spastic, then vibrate on the tricep muscle. If calf is tight, vibrate the tibialis anterior, the muscles on the front of the shin. Frequency 100 to 150 Hz, slightly slower. 45 to 60 seconds of vibration. Watch the spastic muscle will start to relax. At that exact moment, stretch the spastic muscle gently, passive stretching. That is your window, use it. Safety: if there is a blood clot, no vibration. If there is a fracture, avoid near that area. If there is skin broken or any wound, no vibration should be given to the patient. Alright, let's do a quick recap of everything. Icing: flaccid fast strokes top to bottom directly on the muscle. Spastic slow static hold 20 to 30 seconds, just place and hold. Brushing on flaccid fast in the direction of hair growth, feather light touch. Spastic slow stroking down the spine 5 to 6 seconds per stroke. Tapping: flaccid tap the muscle belly, give a verbal command immediately after. Spastic tap the opposite muscle only. Okay, so vibration of flaccid direct on the muscle top to bottom 150 to 300 hertz. Spastic the opposite muscle belly 100 to 150 hertz, same stretch. And the single most important rule: never do fast icing, fast brushing, direct tapping or direct vibration on a spastic muscle. Always work on the opposite muscle. Now let's talk about how recovery actually progresses with these techniques. Okay, so when we consistently apply these techniques on a flaccid patient, the brain slowly starts building new connections. The patient begins moving from stage 1 towards stage 2. Then stage 2 is when spasticity starts to appear, and I want you to understand that this is actually a good sign. It means the brain is waking up and starting to work. But this is exactly the point where you must change your technique from facilitatory to inhibitory, from waking the muscle up to learning to control it. In stage 3, spasticity is at its peak. All four techniques are now redirected to the antagonist muscles. In stage 4, 5, and 6, spasticity gradually reduces. The patient slowly moves toward a normal life. The simple formula for recovery: flaccid to spastic, spastic to selective movement to normal. Okay, so this is the stage direction and speed, and target each of the technique changes at every stage, but the four techniques remain the same. Icing, brushing, tapping, and vibration remains the same. So important things to remember in this: always start these techniques under the guidance of a trained physiotherapist. First confirm with your doctor or physio. It is the most important for flaccid or spastic muscle. Then always do movement exercises immediately after any technique. Reassess every week. The stage keeps changing. Okay, and never make these mistakes. Which mistakes? Fast icing on a spastic muscle, fast brushing on a spastic muscle, direct tapping on or direct vibration on a spastic muscle, continuing if the patient feels pain, doing any technique over broken skin or open wounds. If you have any doubts, ask in the comments. We reply to every single comment. Now I want to tell you about something that can really help you. Here's the thing: every stroke patient is different. Their age, their type of stroke, how much damage happened, which stage they are at, all of these needs to be assessed before building an exact treatment plan. That is why I am offering a one-on-one consultation with you. So we will do a complete assessment on video call, confirm the brainstorm stage, identify your muscle tone and whether it's flaccid or spastic or a mix, build a personalized plan for you, and how to do all these four techniques, and teach you and what are the do's and don'ts at home. And along with that, you will receive a complete home rehab protocol, week by week exercise plan, daily routine, schedule, progress tracking sheet, 30 days of WhatsApp support. To book your consultation, the link is in the description. Click and book your appointment through WhatsApp or simply comment in consult down below, and we will reach out to you. The first 10 people to reach out will get 15-minute assessment session. Comment updates and we will add you to the WhatsApp group. Follow on Instagram for daily tips, link in the description. And in the last, I would like you to tell to like, subscribe and share this video, so that it will help a lot of other patients also. And every stroke client is important, so they can also get a chance to learn the new techniques, the difference between flaccid and spastic muscles, and then what the stages of brainstorms are. So all these will help to another stroke patient also. So kindly subscribe and like and share this channel as more possible. And remember, stroke recovery is time sensitive. The sooner and the more correctly treatment is given, the better and faster the recovery will be. Okay, you are not alone on this journey. We are with you every single step in the way. So it will help you a lot in your upcoming rehab. Also tell me in the comments if there is any patient with spastic or flaccid stage, and they can ask me question in the comments as well. We will reply to every single one. For a consultation, comment consult. For WhatsApp updates, comment updates. Okay. See you in the next video. Thank you so much. Take care. Good night.